It is 2 in the morning. The house is completely still, and you are lying there, wide awake, because your legs will not let you rest. Not from worry, not from noise, but from that deep, relentless burning, that crawling, electric ache that starts in your calves and travels all the way down to the soles of your feet. You shift positions, you stretch, you try to will it away, but it does not stop.
Does that sound familiar? If you are nodding right now, I want you to know something important. You are not imagining it. You are not overreacting, and you are not alone.
What you are describing, that burning, that tingling, that numbness that never fully leaves, is something I hear from patients every single week. Men and women over 60 who were once active, once independent, who now quietly plan their entire day around how much their legs will cooperate. And here is what breaks my heart about this. So many of them have been told by well-meaning doctors that this is simply what getting older feels like, that they should take something for the pain, manage their expectations, and accept it. But I have spent decades working alongside seniors who refuse to accept that answer. And what I have witnessed change in real people, in real bodies, tells a very different story. Because there is something that grows quietly in the natural world that researchers are now calling one of the most promising compounds for calming nerve pain in the legs and feet. And most people over 60 have never once been told it exists. That is exactly what we are going to talk about today. Now, before we go any further, I want to make you a promise. I am not going to stand here and bury you in Latin medical terms. I am not going to pull up research papers and read citations at you for 10 minutes. And I am absolutely not going to give you a college-level lecture on the peripheral nervous system that leaves you more confused than when you started.
I know you've sat through that before. You've watched the videos, you've read the articles, you've nodded along and then closed the tab and thought, okay, but what do I actually do? That ends right now. Everything I share with you today is going to be practical, specific, actionable. The kind of information you can write on a sticky note, take to your local health store, and put to work before the end of this week. No theory, no fluff, no padding.
What I am going to give you is this: the name of the herb, the correct form to look for, because this matters more than most people realize, the right amount, the right timing, and the common mistakes that are quietly making nerve pain in the legs and feet worse for millions of seniors right now who think they're doing everything right. I've spent decades working with patients over 60 who are dealing with exactly what you're dealing with. And what I've learned is that the people who get real relief are not the ones who understand the most theory. They're the ones who do the right things consistently. So let's get into it. Because somewhere right now, Christine is already on the other side of this, and you deserve to be there too.
Now, before I get into the herb itself, I want to speak directly to who this is for. If you feel a burning, tingling, or electric shock sensation in your feet or lower legs, especially at night, this is for you. If your feet feel numb when you wake up in the morning, like they belong to someone else, and it takes several minutes before you feel safe standing on them, this is especially for you. Now, before I get into the herb itself, I want to speak directly to who this is for. If you feel a burning, tingling, or electric shock sensation in your feet or lower legs, especially at night, this is for you. If your feet feel numb when you wake up in the morning, like they belong to someone else, and it takes several minutes before you feel safe standing on them, this is especially for you.
If you've noticed that the bottoms of your feet feel like you're walking on gravel or broken glass or a layer of pins, even on carpet, even in the softest shoes you own, stay with me. If the pain is worse in the evening, if cold temperatures make it unbearable, if you've started sleeping with your feet outside the blanket just to get some relief, you are exactly who I made this for. And if you've been told your nerve pain is simply a side effect of aging or diabetes or poor circulation, and that nothing can be done beyond managing it, I want you to pay very close attention to what comes next, because that is not the whole story. So why does this happen after 60? Why do legs and feet that served you perfectly well for decades suddenly start burning, tingling, and screaming at you in the middle of the night? Here is what is actually happening inside your body, and I'm going to explain it the way I explain it to my own patients. Think of your nerves like electrical cables running through your house. Each cable has a protective rubber coating around it. That coating is what keeps the signal clean, fast, and accurate. Without it, the wire sparks, it misfires, it sends signals that make no sense.
Your nerves have the exact same protective coating. It is called the myelin sheath. And after the age of 50, your body begins producing it more slowly. The maintenance crews start showing up less often. At the same time, two other things are happening. Blood circulation to the extremities, your feet, your ankles, your lower legs, quietly decreases. Less blood means less oxygen. Less oxygen means the nerves at the very ends of your body are the
And here is the part that surprises almost every patient I share this with. After 60, your body's ability to absorb the specific B vitamins that feed and protect nerve tissue drops by nearly 40%. You could be eating a reasonable diet and still be running on empty where your nerves are concerned.
So the burning is not random. The tingling is not mysterious. Your nerves are underprotected, undernourished, and undersupplied with the circulation they need to function. That is the bad news. The good news is that one specific herb targets all three of those mechanisms at once, and that is exactly where we are going next. Now here is where I need to slow down, because this part matters enormously. Most people who try to use herbs for nerve pain make the same three mistakes. And I don't say that to be harsh. I say it because the supplement industry has done a spectacular job of making it easy to buy the wrong thing, in the wrong form, at the wrong dose, and feel absolutely nothing, or worse. Mistake number one. They buy the cheapest capsule on the shelf labeled nerve support and assume all herbs are equal. They are not. The difference between a poorly sourced, low-concentration extract and a properly standardized one is the difference between putting tap water in your radiator and actual coolant. One does the job, one leaves you stranded.
Mistake number two, they take it inconsistently. 1 day on, 3 days off, they forget, they stop when they feel a little better, and then the nerve pain creeps back, and they conclude the herb doesn't work. It did work, but nerves require sustained, consistent nutritional support to rebuild. Stopping early is like pulling a cast off a broken bone after 2 weeks and wondering why it still hurts. Mistake number three, and this one genuinely concerns me. Some people are combining certain herbs with blood-thinning medications or diabetes medications without telling their doctor. Certain compounds in the most effective nerve herbs do interact with these medications. Taking them without that conversation isn't brave, it's dangerous.
Look at what inconsistency and the wrong form are doing. The nerve damage continues quietly, the myelin keeps thinning, the circulation keeps dropping, and the window for easy recovery gets a little smaller every month. The right way looks completely different.
So, what does the right way actually look like? Let me walk you through this exactly as I would explain it to a patient sitting across from me in my office.
The herb is alpha lipoic acid, and before you say, that sounds like a supplement, not an herb, let me clarify. Alpha lipoic acid is a naturally occurring compound found in several plants, most potently in spinach, broccoli, and flaxseed. But the therapeutic concentrations you need to actually move the needle on nerve pain cannot be achieved through food alone, which is why the right standardized plant-based extract is where we begin.
Here is the step-by-step. Step 1. Get the right form. You are looking for R-Alpha Lipoic Acid, not the generic version simply labeled alpha lipoic acid, which is a synthetic mixture. The R form is the one your body actually recognizes and absorbs. It is the form found in nature. Look for it specifically on the label. If it just says alpha lipoic acid with no letter prefix, put it back.
Step 2. Start with the right dose. For nerve pain in the legs and feet after 60, research consistently points to 300 to 600 milligrams per day. Begin at the lower end, 300 milligrams, for the first 2 weeks. This allows your body to adjust and lets you monitor how you respond.
Step 3. Take it at the right time. This is the detail most people miss entirely. R-Alpha Lipoic Acid should be taken on an empty stomach, 30 minutes before a meal. Food, particularly carbohydrates, significantly reduces absorption. Taking it with breakfast feels convenient, but you may be cutting the effectiveness by more than half.
Step 4. Pair it with Benfotiamine. This is a fat-soluble form of vitamin B1 that works in direct partnership with alpha lipoic acid to repair the myelin sheath we talked about earlier. Together, these two compounds address nerve protection and nerve repair simultaneously. 150 milligrams of benfotiamine alongside your R-Alpha is the combination that clinical studies have found most effective for peripheral nerve pain.
Step 5. Commit to 90 days. Not 7, not 30, 90. Nerve tissue regenerates slowly. Patients who report the most significant reduction in burning and tingling are consistently the ones who stayed the course. Christine did every one of these steps, exactly in this order, exactly at these amounts. We will come back to what happened to her. Now, I want to speak to a specific group of you, because I know that not everyone watching this is starting from the same place. Some of you are also managing diabetes. Some of you are on kidney dialysis. Some of you have a digestive condition that makes absorbing supplements inconsistent or difficult. And some of you are already taking 4 or 5 medications daily, and the idea of adding anything new, even something natural, feels overwhelming and, frankly, a little frightening. I hear you, and I want to make sure nobody gets left behind in this conversation.
If you have type 2 diabetes, this modification is critical. R-Alpha Lipoic Acid can lower blood sugar levels. That is actually part of why it works so well for diabetic neuropathy, one of the most common causes of nerve pain in the feet after 60. But it also means you need to monitor your blood glucose more carefully in the first 2 weeks of use, and you must inform your doctor before starting.
Do not skip that conversation. Show them this protocol. A good physician will recognize it immediately. If you have kidney disease or are on dialysis, your ability to clear certain compounds is already compromised. In this case, start at the absolute lower end, 100 to 150 milligrams of R-Alpha only, and only under direct medical supervision. The benfotiamine pairing is generally well tolerated, but again, your doctor needs to know.
If you have a sensitive stomach or digestive issues, some people experience mild nausea when taking R-Alpha Lipoic Acid on a completely empty stomach. If that happens to you, do not abandon the protocol. Instead, take it with a very small, low-carbohydrate snack. A few almonds, a boiled egg, a small piece of cheese. This slightly reduces absorption speed, but keeps you consistent, and consistency over time outweighs perfect timing every single day.
If you are currently on blood thinners or anti-seizure medications, please consult your physician first, not as a formality, as a genuine safety step. Some compounds in this protocol can amplify the effects of these medications in ways that require monitoring. And if navigating any of this feels like too much to do alone, bring this video to your next appointment. Point to these steps, ask your doctor to walk through it with you.
Because the goal is not just relief. The goal is safe, sustainable, lasting relief. That is always the right way. Before I get to the bonus tips, and I promise you, the third one is the one that surprises my patients the most, I want to take just 10 seconds.
If what you've heard so far has been helpful, if something I've said has finally put words to what you've been experiencing in your legs and feet, hit the like button right now. And if you haven't subscribed yet, do that too. Every week I share practical, doctor-backed information specifically for people over 60 who are done being told to simply manage their symptoms and accept less.
By subscribing, you are joining a community of seniors who are actively taking their health back into their own hands. That means a lot, to them and to me. All right,
Now let's get into the bonus tips, because number 3, I genuinely was not expecting this one myself.
All right. 3 bonus tips that go beyond the core protocol, and each one addresses something specific that most nerve pain guides completely overlook. Tip number 1. Cold feet are sabotaging your results. If your feet are consistently cold, and many people with nerve pain report this, your circulation to the lower extremities is already restricted. And restricted circulation means the active compounds in your supplement protocol are arriving late and in smaller quantities to the exact nerves that need them most. The simple fix? Every evening, soak your feet in warm, not hot, water for 10 minutes before bed. Not scalding, comfortably warm. This dilates the small blood vessels in the feet and ankles, opens the delivery channels, and dramatically improves how much nutritional support actually reaches the nerve endings overnight. When your feet are warm, your protocol works harder.
Tip number 2. Your shoes are making this worse. This one surprises almost every patient I mention it to. Tight footwear, even moderately tight, compresses the small nerves that run across the top of the foot and between the toes. Wear that compression for 8 hours a day, every day, and you are actively working against every good thing your supplement protocol is trying to do.
The fix is simple and completely free. Check the width of your shoes, not just the length. Your feet need room to spread naturally with each step. If your toes feel the sides of your shoes at any point during the day, your shoes are too narrow. This single change has reduced nerve pain symptoms in my patients faster than almost anything else.
Tip number 3. Magnesium at night. Here is the one that catches people off guard. Magnesium glycinate, 200 to 400 milligrams, taken 30 minutes before bed, has been shown in multiple studies to reduce the intensity of nighttime nerve pain and significantly improve sleep quality in people with peripheral neuropathy. It works because magnesium regulates the nerve signals responsible for that burning, electric sensation that peaks in the evening. It essentially turns down the volume on an overactive nervous system. It is inexpensive, it is widely available, and for many of my patients, it has been the single addition that finally made sleep possible again. Try even just one of these tonight. By tomorrow morning, you will feel the difference. All right, let us bring everything together. To sum up what we covered today, nerve pain in the legs and feet after 60 is not simply aging. It is your myelin sheath thinning, your circulation dropping, and your body's ability to absorb nerve protective nutrients declining. All 3 things are addressable. The herb that targets all 3 simultaneously is R-Alpha Lipoic Acid, the R form specifically. 300 to 600 milligrams daily on an empty stomach, 30 minutes before a meal. Pair it with 150 milligrams of Benfotiamine to accelerate myelin repair. Commit to 90 days minimum. And if you have diabetes, kidney disease, or you are on blood thinners, have that conversation with your doctor first.
Avoid the 3 most common mistakes: wrong form, inconsistent timing, and dangerous medication combinations. Add the 3 tips that multiply your results: warm foot soaks at night, whiter shoes during the day, and magnesium glycinate before bed. And remember what Christine discovered after 2.5 years of being told nothing could be done. Something could be done. It just had to be the right thing done the right way.
Before you go, I want to ask you something important. Think about who in your life is dealing with this right now. A spouse who gets up 3 times a night because the burning in their feet won't let them sleep. A sister who has stopped walking her morning route. A friend who keeps saying their feet feel strange, but hasn't told their doctor yet. Send this to them, right now, before you scroll past.
Not because I need the views, but because nerve pain that goes unaddressed for months becomes nerve damage that is significantly harder to reverse. And the difference between someone finding this information today versus 6 months from now could be the difference between real recovery and permanent limitation. Hit the share button, send it as a message, drop it in a group chat.
Sleeping through the night without burning feet is something every person over 60 deserves to get back. Walking to their own kitchen without gripping the counter is not too much to ask. And it is not too late. Christine would tell you that herself. I will see you in the next one. Take care of those feet.